Good day. We are the Group 1 and we're going to discuss about managing and caring for the self. So let's start with self-care. Self-care entails making the time to do things that enhance your quality of life and both your mental and physical well-being. Self-care can improve your energy levels, reduce your risk of sickness, and help you manage stress when it comes to your mental health. It means self-care includes everything involved in maintaining physical health, such as good nutrition, hygiene, and seeking medical attention when necessary. It encompasses all the actions a person can take to handle the stressor in their life and to look after their own health and well-being. Let's start with the definition of self-compassion. What a compassion entails, in reality, the two are same. A certain mentality called compassion involves a collection of thoughts, feelings, and motivation that a person's action that can be directed at any living thing. In light of this, especially, we are stating that this when we talk about self-compassion, eternally toward ourselves with an attitude. Knowing our own suffering is a necessary component of self-compassion. While experiencing this, comprehending it, and suffering it, it is a common human experience, but pain is difficult. Directing kindness and concern for oneself, as well as concentrating on potential solutions and self-compassion also requires that we find ways to reduce our suffering. So, what are the benefits of self-compassion? First, enhanced motivation. Instead of making an effort to impress oneself or others, it is important to make an effort because one wants to learn and grow. Self-compassionate individuals are more inclined to accept responsibility for their prior errors while doing so with better emotional composure. Second, promotes health-related behaviors. Setting the stage for greater health, relationship, and general well-being can accomplished by forgiving and nourishing oneself. Lower levels of anxiety and despair are only a couple of advantages of practicing self-compassion. People who have self-compassion are aware of when they are struggling and are kind to themselves during these moments, which can lessen their worry and any accompanying despair. Third, benefits interpersonal relationship. Self-compassion may help people become more self-aware and socially conscious. As a result, having improved interpersonal and interpersonal knowledge becomes a prerequisite for many favorable life events or outcomes linked to both internal, which is emotional and psychological, and external, which is social causes. Fourth, predicts happiness and optimism. Positive emotions are produced by enveloping one's suffering in tender embrace of self-compassion, balancing out the negative ones and allowing for more joyful mental state. Self-compassion seems to improve interpersonal happiness as well as personal happiness. And lastly, enhance well-being. The foundation of improved health, relationship, and general well-being can be laid by forgiving and nourishing yourself. There are several advantages to practicing self-compassion, including reduced anxiety and sadness. Next is main components of self-compassion. Main components of self-compassion includes self-kindness, common humanity, and mindfulness. So let's start with self-kindness. Rather than being self-critical, be kind and compassionate when they struggle, fail, or feel inadequate. We frequently feel inferior to others and spend a lot of time comparing ourselves to them. We consequently frequently experience feelings of loneliness, aloneness, and conviction with no one else shares this feeling. Realizing that we are all flawed is what we mean by having common humanity. It is a sign of human condition. Next is common humanity. Individual inadequacy and suffering are inevitable aspects of being human. We often feel like we're lacking when we compare ourselves to others. Due to this, we frequently feel alone in our problems and alone in the world. We also frequently believe that no one else experiences these things. Realizing that we are all fallible is a sign of common humanity. Being human causes it is a symptom. Instead of telling yourself you're not doing well enough, try telling yourself, I've been working really hard and here are the ways I'm doing that. Last one, mindfulness, observation of thoughts and feelings while maintaining an open, non-judgmental frame of mentality. Being mindful means paying attention to the present moment without passing judgment. It is not the goal of mindfulness or mindfulness-based therapy to empty the mind. It involves observing your thoughts and feelings without criticizing them. Our thoughts and feelings can occasionally seem real. For instance, perhaps the voice is inside our head that tells us, I'm worthless, feels true when it comes from there. Thoughts and feelings may not be the most accurate representations of reality because they are merely chemical processes taking place inside our bodies.
These are the four dimensions of self care. First, physical or the body, to live, move, and breathe. Physical self care entails maintaining a healthy lifestyle that includes eating a balanced diet, drinking plenty of water, and exercising frequently. Second, emotional or the heart, to love, care, and be in a relationship with yourself and others. Establishing firm time and energy boundaries can be part of emotional self care. Third, psychological or the mind, to learn, think, and grow. Activities for psychological self care may involve career and personal advancement. Pay attention to the things in your zone of influence and under your control. Fourth, spiritual or the spirit, to connect with essence, purpose, and meaning. Prayer or meditation can be used as a spiritual self care. You could find it beneficial to imagine, express gratitude, spend time in nature, and reflect on your life's non material components. Here are 5 tips for taking charge of your health. First, get enough sleep. Sleep must come first. An adult needs 7 to 8 hours of sleep per night on average. According to the National Institute of Health, lack of sleep increases your risk of developing heart disease, diabetes, obesity, cancer, and depression. Second, schedule a physical exam. One of the simplest methods to maintain good health is by seeing doctors. For the purpose of preventing disease and early problem detection, routine health checkups are crucial. Third, understand health indicators. You may actively influence your well being by being aware of your vital indicators, such as blood pressure, heart rate, respiratory rate, and temperature, and what they signify for your health. Fourth, keep track of your records. Your personal health records should include information such as your medications, health conditions and medical history, dates and results of checkups and screening tests, contact information for your healthcare providers, and emergency contacts. Last but not the least, improve your lifestyle. By committing to a healthy lifestyle, you can take charge of your health. You can maintain a healthy weight, blood sugar level, blood pressure, and cholesterol level by eating a balanced diet and engaging in regular exercise. Your health is important. Taking charge can mean the difference between prevention and treatment.